Hi and welcome. I'm trying to learn medicine, today Bunion, and after we've done it, we're going to do shoulder impingement training. And if you participate in the shoulder impingement training, that is at your own risk. And we're talking about a disease and an illness and internal anatomy. And this is no medical advice, we're just learning about it. Bunion. Bunion is a harmless swelling of a joint of a big toe. It is particularly common in middle-aged women and usually affects both feet. I'm right now thinking, do have the teeth, the toes, one or two joints? The big toe has just one, like the thumb. I'm right now thinking, do we have, they must have. That's interesting. Okay, the big toe has its joint a swelling, but it's harmless. At least it's not cancerous, so I wondered already just a moment ago when I read it. It will be harmless. Okay, it's a swelling of a joint of a big toe. Symptoms. The joint gradually swells and the skin over it becomes hard, red and tender. Okay, it's swelling. Pressure from a shoe makes the bunion more painful, so it is not as harmless. It has consequences. The big toe becomes displaced towards the other toes of the foot. So it's more to the outside, this way. Duration. A bunion will be permanent unless treated. Okay, it will be permanent if not treated. Causes. Almost always badly fitting shoes. The feet of children, teenagers and young adults are especially at risk from such shoes because the bones of the feet are more easily deformed than those of adults and they feel less pain from the displacement. Why do they feel less pain? Okay, maybe because they are more easily to deform. Maybe this is okay. Okay, it comes from unfitting shoe work, is it shoe work? From unfitting shoes. And it's specifically easy to get if the people are younger, because when the bones are easier to deform, and because they are easy to deform, there is less pain felt, so it has to pay more attention to it that happens. Treatment in the home. Wear loose-fitting shoes and protect the bunion with felt pads obtainable from a chemist. I don't know what it is. Wear well-fitting shoes, and then also maybe felt pads obtainable by a chemist. I don't know what it is. When to consult the doctor. If self-treatment fails to ease the discomfort. Okay, if the discomfort stays on and if the bunion becomes more inflamed and painful. Basically, if there is a bunion. What the doctor might do. Refer the patient to a hospital for an operation. Organize treatment by a chiropractor. Whatever. by a specialist, which is necessary. Surgery, do they say? It would be interesting if there would be a way with exercise going back. All these things which happen through mechanical stress on them, why should they not go back? Especially if it's just in the one direction. Yes, it is a swelling. A swelling of a joint, this is interesting. I haven't thought about it. It is a swelling of a joint because the shoe does not fit. And it's not because the shoe does not fit and there comes blister or something. It is if the joint becomes swollen because it does not fit. It could be actually really problematic, so it's not harmless. Preventions. Always wear well-fitting shoes. This is especially important in the case of young people, so wear well-fitting shoes. If any swelling or inflammation begins to appear on the big toe joint, protect it immediately with felt pads, then take extra care that those shoes fit. I still don't know what felt pads are. Felt pads. Take care that your shoes fit. And if there's a swelling, then act immediately with not wearing these too loose, too tight shoes, and consult the doctor. Outlook. Self-treatment, surgery or chiropody will nearly always considerably relieve or clear up the trouble. Okay, stopping to wear shoes which are too tight, if it acts early enough, that might help already. Surgery might help also, and chiropody might also help. Okay, bunion. If people wear too tight shoes, that can lead their joint to inflame and swell. And that is, if not acted against this, permanent. Now, metaphors, if you were here for medicine, you can go directly to the next part of medicine. If you are here for short and pension training, then you can stay here. But if you participate, there's better the arm risk. What is it? Stance, and we're doing forward shoulder circles. We're going back with shoulders, up, and front, and down. And back. I just remembered when I know the name Bunion from John Bunion. The poet. In front, up, back, and down. And next exercise, long arms, strong fists, and we're going as far back as we can with shoulders. High up, and in front, and down. Again, back, up, and in front, and down. And now, up, and back, and down. Front, and up, and back, and down. Next exercise. Legs wide apart, into the knees, hinge forward, have straight back, lift the arms hang, and pinch the scapulars together with effort. Now make fists, lift the arms up, and still pinch the scapulars together. And relax. And another time. Pinch the scapulars together. With effort. Now make fists, lift the arms up, and still pinch the scapulars together. Now, relax. And a sheet jumper. Into the knees, pinch forward, this time with the round leg, the arms hang, make fists, turn the arms to the inside, lift the arms high up, bring them together, straighten up and bring the shoulders down, hands together. Arms high up, hands together, shoulders down, hands together. Release, and now round into the knees, hinge forward, with the round leg, and the arms hang, make fists, turn the arms to the inside, lift the arms high up and bring them together, bring the shoulders down, hands together. And it sounds like hospital bounce. Okay, next exercise. We are lifting the arms up. And again down. Just the arms up. If this exercise causes pain, then don't do it. And to the outside. And in front. Just observe what the scapulars are doing. We should go now a bit to the outside. And a bit back together. Next exercise, we will lift up. Long arms, strong fists, shoulders down, together. Turn the arms to the inside. And bring the shoulders down and together. Arms to the outside, shoulders down, and together. Arms to the inside, shoulders still down and together. And arms to the outside, shoulders down. And release. Similar exercise. Arms to the outside, hands onto fists, right in front. Turn the arms down in front, shoulders down, hands together. And switch, arms back, shoulders up, and in front. Change. Arms in front, shoulders down, and together. Change last time. Arms back, shoulders up, and in front. Release. Now shrug. Lift the arms up, and shrug the shoulders up, and release it all down. Again, the arms up, shrug the shoulders up. And again, breathe in and lift the arms up. You can breathe in. Shrug the shoulders up and release it on down. Next exercise, pretzel curl. Arms together, a bit down to one side, again down and to and the exercise before stretching is something like that. Have something like a sock or tennis ball with a long arm at the outside, and then fall down and catch it again, repeat it and hold slowly. And on the other side. Now we mentioned stretching, one arm in front, shoulders back, down, pull the arm in, have flat fingers, try to relax the arm, and come back with the shoulder, and turn the palm a bit up to the sky. And the other arm in front. Shoulders back, down, pull the arm in, have flat fingers, try to relax the arm, turn the palm a bit up to the sky. And that was the short today. I thank you very much and